The era of the miraculous pill is over. For less than 100 years, humanity lived in a biological bubble. We forgot that for the vast majority of human history, a simple laceration, an infected tooth, or a bout of dysentery was a death sentence. In a collapse scenario, the pharmacy shelves will be stripped within 48 hours. The supply chain for synthetic antibiotics, penicillin, amoxicillin, ciprofloxacin will cease to exist. You are returning to the medical reality of the 19th century. Survival in a post-antibiotic world is not about luck. It is about the rigorous application of chemical and biological principles. If you wait until you have a fever to react, you are already a statistic. The strategy relies on 3 layers of defense: aggressive prevention, localized treatment, and systemic intervention using naturally occurring compounds. Phase 1: mechanical decontamination. The most critical factor in surviving an injury is not what you apply to the wound later, but how you manage the initial trauma. In a sterile hospital environment, surgeons rely on systemic antibiotics to cover errors in cleaning. You do not have that luxury. You must perform immediate and aggressive irrigation. The solution to pollution is dilution. You need liters of water, not drops. The water must be boiled or chemically treated. Introducing waterborne pathogens to an open wound is counterproductive. Use a syringe or a plastic bag with a pinhole to create pressure. You are not just rinsing, you are blasting bacteria and debris out of the tissue. Next is debridement. This is the removal of dead, damaged, or infected tissue. Necrotic tissue has no blood supply. It is a sanctuary for bacteria where your immune system cannot reach. If the tissue is gray, black, or does not bleed when cut, it must go. This process is painful. Pain is irrelevant. Leaving necrotic tissue in a wound ensures gangrene. Phase 2: natural antiseptics and topical barriers. Once the wound is mechanically clean, you must create an environment hostile to bacterial growth. Alcohol and hydrogen peroxide are for cleaning tools and intact skin around the wound. Do not pour them directly into a deep wound. They destroy healthy cells and delay healing. You need agents that kill bacteria without destroying the tissue trying to repair the breach. Your primary asset is raw honey, not the processed syrup in a plastic bear, but raw, unfiltered honey. It operates on 2 mechanisms. First, it is hygroscopic. It draws water out of bacterial cells, dehydrating and killing them. Second, when applied to a wound, an enzyme called glucose oxidase produces low levels of hydrogen peroxide continuously. It creates a sterile barrier. Apply it directly to the wound bed and cover it. Change the dressing every 24 hours. If honey is unavailable, look to pine resin. Coniferous trees produce resin to seal their own wounds and prevent infection. It contains abiotic acid, a potent antimicrobial. Collect the sticky sap directly from the tree. It can be applied directly to a wound as a glue and antiseptic sealant. It stops bleeding and seals the breach against external contaminants. Phase 3: systemic botanical intervention. When infection breaches the local tissue and enters the bloodstream, topical treatments are insufficient. You need systemic agents. You must identify and stockpile specific botanical compounds now, not after the collapse. The first is Allium sativum, garlic. This is not a culinary suggestion, it is a chemical weapon. Garlic contains alliin. When the clove is crushed, an enzyme converts alliin into allicin. Allicin is a broad-spectrum antimicrobial agent effective against gram-positive and gram-negative bacteria, including some multi-drug-resistant strains. To use it medically, you must crush the clove and let it sit for 10 to 15 minutes to maximize allicin production. It must be consumed raw. Cooking destroys the compound. The dosage for an active infection is high, 3 to 4 cloves daily. It causes gastric distress. This is a side effect you must tolerate. The second agent is usnea, often called old man's beard. It is a lichen found hanging from tree branches in clean air environments. It looks like gray-green hair. The active principle is usnic acid, which disrupts the cellular metabolism of gram-positive bacteria like Streptococcus and Staphylococcus. It is particularly effective for respiratory and skin infections. It can be dried and powdered for wounds or extracted in alcohol to make a tincture for internal use. Identify this lichen in your area. Verify it by pulling a strand apart. Usnea has a white, elastic central cord. Lookalikes do not. The third is echinacea, specifically the root. While often marketed for colds, in high concentrations it stimulates phagocytosis, the process where white blood cells devour bacteria. It does not kill bacteria directly, it supercharges your body's ability to do the killing. It is best used at the first sign of infection. Phase 4. Fever management. You must understand the physiology of fever. It is a defense mechanism, not a disease. A rise in core temperature inhibits bacterial reproduction and increases the efficiency of immune cells. In a modern context, we suppress fevers for comfort. In a survival context, suppressing a moderate fever is an error. Let it burn. Only intervene if the temperature approaches dangerous levels, above 104 degrees Fahrenheit or 40 degrees Celsius, where protein denaturation begins. To reduce dangerous fevers without pharmaceuticals, use evaporative cooling, tepid water on the axilla and groin. Willow bark, which contains salicin, the precursor to aspirin, can be used as a tea, but use it sparingly. It reduces pain and inflammation, but also thins the blood, which interferes with clotting. Phase 5. Surgical intervention. If an infection localizes into an abscess, antibiotics, even natural ones, cannot penetrate the wall of pus. The pressure must be relieved. The procedure is incision and drainage. Sterilize a blade with fire or alcohol. Make a bold incision at the point of maximum fluctuation. Do not make a small puncture. It will seal over. The incision must remain open to drain. Pack it with gauze soaked in honey or saline to prevent it from closing prematurely. The infection must heal from the bottom up. If it closes at the surface while bacteria remain deep, you have created a time bomb. The reality of sepsis. You must recognize the point of no return. If you see red streaks tracking up a limb from a wound, this is lymphangitis. The infection is moving toward the heart. If this progresses to sepsis, systemic poisoning, the mortality rate without intravenous antibiotics is nearly absolute. Your only option at this stage is massive hydration and aggressive dosages of the systemic agents mentioned, raw garlic and usnea tincture. Shock will set in. Keep the patient warm and elevated. The body is fighting a war of attrition. Most will lose. Conclusion. The stockpile in your medicine cabinet has an expiration date. Knowledge does not. In the future, a minor injury will require the same attention to detail as a major surgery. Hygiene is your armor. Debridement is your weapon. Nature provides the ammunition, but you must know how to refine and deploy it. Stockpile raw honey. Learn to identify antimicrobial flora in your biome. Practice aseptic techniques now. When the grid goes down, the microscopic world will reclaim its dominance. Make sure you are not the host.